Hi, I'm Pooja, also a former USDS. I'm going to round us out here with a slight change of pace. So we've largely been talking about federally implemented programs to date, but if you think about it, aside from filing taxes and taking care of our seniors, some of the biggest programs for Americans' experience of day-to-day government is these social services that are state implemented. So I've listed a few of them here, Medicaid, SNAP, childcare. These are massive programs, both in terms of dollars and impact on people's lives. So just to call out Medicaid alone, right? It's healthcare for over 20% of the population. Half of babies born in the US are born under Medicaid. So these programs are federally funded, but state administered. What does that actually mean? Well, much like it sounds like, it means that there's a federal underpinning, but there's basically 50 plus implementations of each of these programs. Each state implements its own version, designs its own application, builds out its systems. They're incredibly complex programs, and that all underpinned by tech, and that complexity often manifests both for the staff that are working on these programs and also for families trying to receive benefits. So I'm going to tell two stories about some teams at USDS that dug in a little bit more into implementation of these programs and really focused on, ultimately it's states leading, right? They're state-administered programs, but really elevating, what can good look like and demonstrating best practices so states can adopt them as they see fit. So I'm going to show two examples from pretty different angles, but that ultimately had similar themes. The first is related to the Child Care Assistance Program. So those of you who have small kids probably know that the cost of childcare in this country is bananas, for lack of a better word, and for low-income working families, this program is really a lifeline and supports over 1 million families in the country. So we were invited to work with the Administration of Children and Families, which sits within HHS, to explore a little bit, what are opportunities to improve the program. And the very first thing we did was we set out and we talked to state staff and we talked to families to hear directly from them, what's working, what's not working, what are the challenges. And a thing that came back pretty consistently was the applications. And so we dug in, and they're burdensome both for families and for staff. And we dug in and we saw kind of a huge variety of how these are set up. Some were 1 page, some were 16 pages, some required 4 months of paper pay stubs. Like it was really all over the map. And when we dug into why that was, a lot of it actually stemmed from lack of clarity around the policy. So the state staff that made the applications maybe 10 years ago didn't quite understand the policy intent because it wasn't clear. It's written in policy ease, and it's not always intuitive what it means. So that manifests in the application. By the time the application makes itself to the families don't understand it. They submit something back, and you're stuck in these administrative loops that are both bad for the staff and bad for families that kind of desperately need to know if they're going to be able to get these benefits to plan their lives. So what we did based on these learnings from what we heard from states and families was take a crack at creating this resource that was both kind of a guide for creating a family-friendly child care assistance application as well as a model application. And this was not, rocket science. It wasn't like some amazing technical feat. It was really about the basics of translating something that was not clear to folks into plain language so that everybody at every level kind of understood what was the intent, how can we make it clear and understandable for everybody involved. It included both that kind of plain language explanation as well as a model application that was modular. So if states wanted to take parts of it, they could. If states wanted to take all of it, they could. And we also included some examples of what are other states doing, because we heard that pretty consistently, that states did not necessarily want to be reinventing the wheel. They wanted to know what's already working. So we launched this. It was well received. A good number of states adopted quite a bit of this over time. And this is really an example in user-led design and really understanding what is helpful before we kind of decided what would solve the problem. And I'm proud to say that this resource is still alive and being updated, and so you can check out the URL if you're interested in learning more. The other example I'll give was more, I think we all have to talk about crises, so this is more on the crisis side of things related to scaling Medicaid renewals at the end of the public health emergency. So during COVID, there was waivers put in place, so families weren't submitting the typical documentation for renewal that they would, and there was kind of a crisis looming because those waivers were coming coming to an end, and these processes would pick back up. And by some estimates, folks were expecting almost 70% of families. So just think about the Medicaid population. A lot of it is children. Almost 70% of folks were going to get kicked off for various administrative reasons, and maybe not even know that that was happening. And states were facing a challenge where they often didn't even know how to get in touch with these people. They may not have the up-to-date phone numbers. They might not have the addresses. So it was really kind of an all hands on deck. Everybody's, I don't want to say freaking out, but like it was what do we do to kind of mitigate the damage that could happen here? So the teams honed in on something that was called, created under the ACA, called ex parte renewals. And what that basically means is that, okay, we as a state may already have some of the information proving that they're eligible, and how can we auto-renew them on the basis of that? Which sounds straightforward enough, but in practice, as you all would expect, this information was all across disparate systems. It was kind of unclear how to find a lot of it. So there was a real tiger team effort put in place where folks from USDS and the agency and vendors and really would be sitting in these horrible conference rooms for weeks digging into, maybe they're nice conference rooms, but sitting in these conference rooms for weeks really digging into like the nitty gritty of these systems so that we can find the relevant information for auto renewal and be able to keep these folks that are eligible for coverage enrolled. While teams were in there, they also noticed other things, right? So similar to what I mentioned for childcare, these challenging policy, and actually for FAFSA, right? Like a lot of these challenging policies don't always get implemented the way that they were, anybody was expected, and how it's implemented is what's real. And so when we were in there, we noticed, okay, you're actually not supposed to be taking off a child when a certain adult is taken off, and that was happening. So we found a lot of other opportunities to kind of improve that, and I won't go into all the details of the slide, but for states that did this kind of work, they saw clear improvements in renewals, and importantly, clear decreases in some of the rejections, where folks were being denied not because they weren't eligible, but because they didn't have the right paperwork. So, as Mina mentioned, huge impact in terms of families and children that were able to stay on Medicaid, and during this kind of huge moment of administrative burden. So there's two things I'll leave you with here. One is just to reiterate that none of this is like magic or rocket science. It's really getting into those really often boring, very in the weeds details of, okay, how is this actually supposed to be working, and are we implementing it properly? And in the moment, they're often kind of painful, but the reality is that these benefits really matter for a lot of people's lives, and that's why you're doing that work. The other thing I'll note is, as again, everybody's aware, there's a lot of changes happening right now to the rules and how these programs will work, and that just means that this kind of work will continue to be even more important because states will need to keep up to date with how to administer these programs, and hopefully in a way that works for families and reduces their administrative burden. So if you have the opportunity to do state work, hopefully you're able to, because it's really, really high impact, and these programs really make a difference in folks' lives. Thank you so much.